And now I give the floor to representatives of civil society from Singapore. And first speaker on my list is Jolene Tan, who represents 4 NGOs: Women's NGO Coalition, Home, TWC2, and Center for Domestic Employees. Please.
Thank you, Madam Chair. I am part of the Women's NGO Coalition. Today I speak first about violence against women. Sexual violence of all kinds is common and underreported. Few employers have policies on workplace sexual harassment as they are not legally obliged to do so. Women assaulted by supervisors often choose between their livelihoods and their safety. Moreover, marital immunity applies to rape, including rape of a minor, despite statements by Singapore to the UPR in 2016. Both the public and authorities lack awareness on consent and the realities of gender-based violence. Recently, in acquitting a man of sexually assaulting a 15-year-old, the judge criticized the victim for taking several months to speak up about her assault. The domestic violence regime does not cover non-married intimate partners. Second, the migrant wives of citizens. Despite the committee's last concluding observations, these women face unclear immigration rules, discriminating based on income, HIV status, and other factors. No clear path to stable residence is offered, even for mothers with citizen children. They face discrimination in legal representation, healthcare, public housing, and permission to work. One pregnant woman lived on a lorry until social media pressure secured her help. Many more suffer without attention. Third, Muslim family law. Muslim inheritance law creates unfair outcomes, disadvantaging women. We urge that Muslims should have a choice between Muslim and civil law in distributing their estates. The state should seek to end polygamy while protecting women already in such marriages. Muslim women should not need consent of a male relative to get married. Fourth, employment discrimination. Employers can discriminate based on sex, gender, marital status, sexual orientation, and gender identity without legal consequence. We see discrimination based on pregnancy and motherhood, with one woman returning from maternity leave to find a letter of termination on her desk. Muslim women who wear a headscarf are barred from some jobs, including in public institutions. Fifth, migrant domestic workers. They face systemic exploitation and abuse. Excluded from labor law, they are not entitled to paid public holidays, sick leave, annual leave, and limits to working hours. Reports of workers being locked up with mobile phones confiscated are common. Though the law calls for a weekly day off, most do not enjoy it, as employers are permitted to compensate them instead. Because the government does not allow domestic workers to switch employers freely, they are virtual slaves in their employers' homes. If they try to assert their rights, they risk repatriation. The state should do more to educate workers about their rights and support them in asserting them. To combat salary non-payment, the state should make electronic payments compulsory and facilitate the opening of bank accounts for workers. The state should also better regulate and enforce against recruiter malpractice, including efforts to address issues in sender countries. Workers often pay 6 to 8 months of wages to recruiters, and the state does not act on complaints against this, despite laws placing limits on agent fees. If fees are paid for training, the state should ensure it is provided to appropriate standards and certified. The government forces workers who leave employers' homes and seek help at NGOs to report to them. The worker is compelled to report abuse and to remain to assist in lengthy investigations against her will. An anti-human trafficking law has been passed, but key indicators and definitions are poorly defined or non-existent, and the rights of victims are limited and not enshrined in law. Thank you, Madam Chair.
Thank you very much. And now I give the floor to Ms. Alina NJ from NGO Sayoni.
Thank you, Madam Chair. We are part of the Women's NGO Coalition. Sayoni's research found 3 pressing issues affecting lesbian, bisexual, and transgender women, or LBT women. 1. Discriminatory stereotypes reinforce violence. It was highlighted at the previous CEDAW session that the state should eliminate discriminatory stereotypes of LGBT women from the media. However, the state has failed to act. Positive depictions of LGBT characters continue to be barred. This promotes prejudice and deprives LGBT persons of positive role models, affecting self-esteem and normalizing rights abuses. 2. Promoting violence in education. State schools lack affirmative education and assistance for LGBT women. Sex education is abstinence-based, giving inadequate information about consent and diverse sexualities. Educators fail to help LGBT youth due to institutionalized homophobia. For example, a 15-year-old girl was sexually and psychologically abused by her girlfriend, but she did not recognize the violence, and her school counselor put the blame on her instead. 3. State-sanctioned domestic violence. Family members frequently use psychological and physical violence on LGBT persons. For instance, a lesbian was punched, slapped, and kicked by her father until she urinated, fainted, and sustained a concussion. Criminalization in Penal Code Section 377A and social stigma prevent LGBT persons from accessing protection and justice from violence by private and public actors. They also continue to be excluded from state policies. Thank you.
Thank you. We also have NGO Project X, which is represented by Eliza Jafar, please.
Good afternoon, Madam Chair. I address the concerns of Singapore sex workers. First, on recognition of sex work as work, sex work should be recognized as a meritocratic and alternative form of work. Sex work itself may not be criminalized under the law, but its related acts are soliciting in public place or using remote communication services to advertise for sex work is bad. This violates our right to work, livelihood, and control of our work conditions. Second, on healthcare, sexual and reproductive rights. Licensed sex workers are subjected to mandatory STI testing. This violates our right to privacy, the right to control our bodies and health, including sexual and reproductive health. Several health programs for the sex worker community are ineffective and inadequate. As a result, they cannot access the appropriate level of healthcare and treatment. For licensed migrant sex workers detected of having HIV or AIDS, they will be deported immediately and banned permanently from coming to Singapore without any access to healthcare or other social services in Singapore. Third, on the rights of migrant sex workers. The Immigration Act categorized unlicensed migrant sex workers as prohibited migrants. Unlicensed migrant sex workers and licensed sex workers at the end of their contract are subjected to a travel ban. The ban period varies based on nationalities and offences and can be lifelong. These deprive their rights to freedom of work, residency, and the rights to leave and return from one country to another without any state interference or coercion. They also have no access to sexual health programs available to licensed sex workers. Fourth, on trans women sex workers. Transgender women are unfairly targeted and profiling by the police to be unlicensed sex workers. Subjected to criminal penalty. Furthermore, the law criminalizing sex between consenting men deprive many pre-operative and non-operative trans women sex workers their rights to engage in consensual sex work. Finally, we suggest to the community to urge the government to reform the state policy on sex work, to ensure the law protects gender equalities for all women, and to repeal immediately Penal Code Section 377A. Thank you, Madam Chair.
Thank you very much. It's okay. We have some extra time. Yeah. So now I give the floor to Susan Harding, and she will talk for NGO ILC CEDAW Foundation, please.
Thank you, Madam Chair. I'm here today to highlight the situation of older women. Singapore's aging population is predominantly female. The report should have a greater focus on them. Their needs are different from those of older men, and future policies from healthcare to education and employment should consider the implications of these gender differences. Allow me to illustrate where these are being played out. In Singapore, caregiving still has a female face. The government should foster shared caregiving of older persons by both men and women. Education and mass campaigns that have been successful in reducing gender stereotypes relating to childcare should be extended to remove stereotypes about elder care and increase awareness that it should also be a responsibility of men. The female working caregivers are calling on the government to support them by considering legislating and adding on at least 2 days of family leave to take care of their elders. Caregiving results to interrupted work history for women. This impacts their ability to earn and to save for their retirement. They become vulnerable to financial insecurity in old age. Of those working, they are mostly employed in lower wage and lower skill jobs. The government should intensify measures to support these women to remain working and encourage full-time housewives and caregivers to rejoin the workforce by providing better support structure similar to the scheme being offered to working women with children. While the report states that the Central Provident Fund provides the foundation for Singapore's social security framework, it does not elaborate on alternative measures in order to support women's financial security in old age. A match savings scheme that would assist them to reach their CPF retirement sum and support them to remain independent should be implemented. The work by the Women's Health Advisory Committee should be extended to include making health a priority for full-time homemakers and caregivers. Last, the setting up of a commission on older women is being called for to represent their interests and perspectives as well as to assess the changing needs of Singaporean women. Thank you very much.
Thank you very much.